Hey, Healing Family. Today, I wanted to give us a quick tool that we can use to help with our vagus nerve to calm down our nervous system and our limbic system. And it's super simple. It is the ocular cardiac convergence exercise. So, this is also known as eye convergence and accommodation reflex exercise. So, this is going to involve coordinating our eye movements that stimulate the vagus nerve and calm our limbic system. And it's based on the reflex arc that connects eye movements, heart rate, and the nervous system, particularly through the vagus nerve pathways. This exercise involves focusing the eyes inwards, convergence, and crossing them slightly, and then sometimes shifting our focus between near and far objects. So, this requires both convergence, the inward movement of the eyes, and accommodation, focusing adjustments by the lens of the eyes. This movement also activates the vagus nerve, specifically through the ocular cardiac reflex, and this reflex happens when eye muscles and vagus nerve interact. It slows down heart rate and activates the parasympathetic or rest and digest mode of our nervous system. And the limbic system, which processes our emotions and stress, is deeply affected by vagal tone. So, when the vagus nerve is activated, it sends signals to the brain to decrease the fight or flight response. And this can bring a sense of calm and help regulate our stress responses over time. Using this exercise is going to help with calming the limbic system and helping with chronic stress, anxiety, and trauma responses. It also is going to reduce the release of stress hormones like cortisol. And a strong vagal tone is also associated with high heart rate variability, which is linked to better stress resilience and cardiovascular health outcomes. So, what we're going to do here, it's a very simple step-by-step instruction for oculocardiac convergence. First, we're just going to find a comfortable seated position with our spine nice and straight. Feet are flat on the floor. You can rest your hands in your lap. We're going to grab some sort of object that we can focus on that's nice and easy to hold in front of us. I literally grabbed a paintbrush of my daughter's that was laying around. So we are going to hold this object out in front of us about an arm's length out directly in front of our eyes, and we should keep it eye level and easy to focus on. We're going to slowly bring that object towards our nose with our eyes fixed on the object, bring it towards the tip of our nose, and try to maintain focus on that object as it moves closer, so your eyes will naturally converge or move inwards to keep focus. When the object is close to your nose, about 1 to 2 inches away, pause for a few seconds. We're going to take a deep breath in through our nose and slowly exhale through our mouth, allowing your heart rate to slow. Then move that object back away to arm's length while keeping your eyes focused on it. Allow your eyes to relax and return to their normal position as the object moves away. Repeat this about 5 to 10 times. Just working on that convergence. And then in between, letting our eyes readjust and look at things behind. Then we can also do another exercise where we hold it about arm's length and we allow that convergence. So we're looking directly at the object in front of us, so everything behind becomes a blur. And then we're going to shift our focus looking beyond the object and trying to focus on something a little further away. And then refocus our eyesight and our intention on that object with that convergence, maybe bringing it a little further or a little closer. And then shift our awareness and our vision to something beyond the object on the other side of the room, perhaps. So this is helping us to get that difference in between focusing on the object and looking beyond, keeping our breath consistent throughout this exercise. Remember, we're going to focus on slow, controlled movements and steady breathing. If you feel any strain or dizziness, pause, close your eyes, take a few slow, deep breaths. Aim to stay as relaxed as possible. The goal is engaging that parasympathetic rest and digest response through gentle, mindful practice. And this is a simple exercise that activates the vagus nerve, and we can use it daily as needed. Obviously, if you have any specific eye health issues, you want to clear this with your doctor before completing this as a regular part of vagus toning exercise. However, using convergence and accommodation is something that we're going to do throughout the day anyway. We do this when we're driving, we do this when we're reading and then looking up. So it is a pretty benign exercise as long as medically you are cleared for eye health issues. From a heart health perspective, this oculocardiac convergence exercise leverages the connection between the eye muscles, the vagus nerve, and the heart to create a calming effect. In the heart health and heart rate variability portion, this convergence of the eyes triggers an oculocardiac reflex where eye movement sends signals through the vagus nerve to slow down the heart rate so that we can focus. And this balances our autonomic nervous system. At a higher heart rate variability, we are referring to this variation in time between each heartbeat, and it's associated with better cardiovascular health and resilience to stress. Also, slow mindful breathing and improved heart rate variability can lead to lower blood pressure by calming the heart and supporting overall health. So if you are dealing with chronic stress or trauma or being locked into fight or flight mode or any of our limbic system related issues, this can be a great quick exercise to practice daily. And let me know in the comments below what you think and if it helped you today.